Hey guys, Trev here from SpineWise, and thank you for joining me again today. So I want to talk to you about this term slipping a disc, because if you ever damage your neck or you damage your back, chances are someone's mentioned to you the concept of have you slipped a disc. But what does that actually mean? Because in reality terms, we can't actually slip something outside the spine. It'll be a major problem if it is. So what does it mean and how does it actually affect you? And if you hang around to the end and this relates to you, then I'll also give you some strategies that you can use to potentially help you recover from your disc injury as well. Before we get into it though, like always, if you're loving our videos, you want to see more of these, please like our channel, subscribe, also follow us on our Facebook page as well. We're always trying to get more information out to help you in any way we potentially can. All right, so let's talk about these discs and structure of a disc. So a disc actually is a central, like an egg, like a central soft center that has this firm outer area that holds it into place. And the whole reason it sits like that is that we have almost like two plates that sit on top of each other, and that allows us to roll over the top forward and backwards, side to side, and gives us that freedom to actually move, and at the same time provides us with shock absorption as well. So this is really critical for us in terms of getting movement and keeping ourselves healthy heading forward. In some circumstances though, especially as we start getting older and we've done certain things to our spine starts to break down a little bit, we can tear that outer area that holds that central nucleus together. And when we tear it, the central areas can start leaking out into the outer sides of the spine, into the discs. And when they do that, depending how far they go, they can start irritating nerves and potentially even your spinal cord. So what we need to understand first of all is that this is a very common thing to be happening in most people just as part of degeneration. So there have been some studies which have suggested up to 80% people who have never had a problem with their back in any way, shape or form can still have these disc type injuries. So we need to understand that just because you have a disc injury or something's picked up on a scan doesn't necessarily mean that that is actually the cause of your pain. So we need to make sure that we differentiate disc injuries from other injuries such as standard sciatica, arthrogenic reflex patterns, sprains, strains, all these type of things, because not all back pain, just because it has been seen on an MRI or a CT, doesn't necessarily mean that is the cause of your problem. But all right, let's have a look a little bit more detail. So the gold standard when we're talking about looking at disc injury is the MRI. So we have a great little image here. So if we look at a broad MRI here, if we take this little section out and then we zoom in over here, what we can see here, if we look down the area, the central, which is where our spinal cord is, we look through that area, what we can see is the discs coming through here. So these are our discs coming through here, and in this situation we can see this disc that's actually protruded back into the spinal canal and is now actually putting pressure on the spinal cord itself. So this is the beauty of MRI. We can see this stuff on an MRI that we can't really see very clearly on a CT or an X-ray at all. So the gold standard really is MRI. But what is it that we're actually seeing here? Because this is what you're seeing on an MRI when you get a scan report back and it says you've got a disc protrusion or disc prolapse or something like that. This is what's actually being seen to some extent. So what does that actually look like? Right, so we move over here now. This is kind of what we're seeing from here. It's just a little bit different because we don't see the colors and things like that with it. But if we can imagine the central area here, this is our nucleus in the center here. On the outside, we've got our nice firm, what we call annulus, that holds it all together. And then what ends up happening is at some stage we tear this annulus. So we make damage through here and we tear it. And then as we tear it, this nucleus can then leak out. And as it leaks out, it can either bulge this way, which is what we call a protrusion, or it can actually start really coming out and even herniate into the space itself. So as this comes out this way, it then creates this bulge type appearance, and the result of that is it can push back into the spinal canal itself, or it can push back into the little holes on the spine where the nerves come out from. The result is pressure on that nerve and decrease or altered function of that nerve coming out. So this is what we term or what has previously been termed a slipped disc, is when this disc has actually slipped out into areas that it doesn't belong anymore. Okay, so this is what we're looking at. So the key thing you need to understand with this is that Majority of people, as soon as they start thinking this, think that they need surgery, and that's not the situation at all. There are some circumstances where it's come so far back that there is a risk to your long-term neurological health, and that's kind of a bit of a medical emergency, and that's when we start seeing people potentially losing bladder or bowel control, either not able to go or not able to stop themselves from going, and sometimes we start seeing severe neural patterns in the periphery, like severe loss of sensation and things like this. That can be medical emergencies that require immediate surgery. But for the average person that has a disc injury, these type of things quite often will settle down within a 6-month time frame. That's their natural history. They just settle down by themselves. But these things can be sped up by a lot of things that can be done by practitioners, and even things that you can be doing yourself. So the first thing we need to understand when we're looking at these disc injuries is that you need to keep moving, okay? This is really, really important. You need to keep moving. If you're at the point where you can't bend over or you can't move a leg because of the pain that goes down there, you really need to get immediate help, because now we're starting to talk about the potential for major issues going on and potential for surgery if we can't get to that early enough. Okay, but for those who have disc injuries, might be getting some back pain, might be radiating outside, maybe had a little bit of numbness here or whatever, we need to keep moving. We need to keep moving in order to keep inflammation down and keep control of that area as well. Second thing we need to do is we need to get the support back up and running immediately. So one of the most common ways that we've seen disc injuries happen here in the past is somehow or another there is a lack of support to the spine. So therefore posture is changing, whether it be an increase in curvature, whether you be playing a sport where you're rotating and you're not having this ability to stop yourself correctly like you should with that lack of support. And the result is that force goes through the disc, which ends up damaging the disc. So we need to make sure we get that core strength back, we get that core support back in order to prevent any further injury happening at the disc level and to make sure that we can also recover from it. There's a few things you can do nutritionally with it as well. We need to make sure we get inflammatory levels down. So when we start talking about inflammatory levels, we've got to start talking about carbohydrate intake, sugar intake, alcohol intake. These things have got to be reduced in order to get that inflammatory markers down. It's okay to have inflammation because we need healing, and inflammation is part of that healing process, but we don't want inflammation there going on for months and months and months, because this will create more and more and more damage. So that's not what we want to have happen. There are some supplements which have also been shown to help these type of things. Again, not a lot of research on this as yet, but in theory, these things do seem to have a benefit, and we've seen some of these have great responses with patients in our office with this type of stuff. So collagen support products, so things that can help build the tissue around those areas. So things like peptides, there are certain peptides that do that. There's things like bone broths and things like this that have that high amount of peptide can have an effect. We've also seen things like manganese that helps an enzyme called SOD have some improvement in some of these areas as well. And then also simple things like vitamin C and stuff like that improve collagen, that collagen matrix, sometimes even glucosamine, things like this that really help that collagen matrix build that support back, that ligament strength back, can sometimes help repair these areas as well. As I said, not a lot of research on that type of stuff as yet that I'm aware of, but we've definitely seen in our office some people get good responses by controlling those factors as well. So now guys, that's some information, a quick introduction for you in terms of disc injury, how you can go about managing it, a few things that you should do, and what to look for, and what your CT and MRI actually means when you see it in a real life anatomical type structure. Anyway, if you have any questions with any of that at all, just post it up. Otherwise, send me a message. Always happy to help out in any way, shape or form that I can. Remember, if you're enjoying our videos, please like our page, please like and subscribe to our video on YouTube as well. We're trying to get as much information out for you as we possibly can. If there's something you want me to discuss, just message me, post it up. Always happy to help you guys out in any way, shape or form that we can. Anyway guys, until the next vid, we shall see you later. Bye for now.